Well, too often when we think of our health, we think of physical ailments, but your mental health is just as important. That's why it being May Mental Health Month, this is the perfect time to take a free anonymous screening for a variety of mental health disorders, including depression and anxiety, which we're going to talk about this morning. Christine Gorgas is the operation manager at Gulf Coast Clinical Research Center. Good morning.
Good morning.
Welcome back.
Thank you.
So I know May is an important month for you guys, you know, many others too, but why do you think this is such a great time to maybe talk about mental health disorders, which again are just as important as physical needs?
May is really the month where the community really comes together and looks at community research and education regarding mental health. It's one of these opportunities where organizations across the United States, not only clinical research sites such as ourselves, but primary care physicians, hospitals, really try and focus on educating people about mental health disorders and how they can really affect their lives.
Well, and it also gives it a time for people to say it's okay to talk about. Sometimes there's this stigma that's with any kind of mental health awareness that doesn't need to be there.
Absolutely. We have a lot of tools now that are designed to be anonymous screening tools that patients can do online, where they can slowly walk through the different symptoms, see if this is something that resonates with them, if there's something that really speaks to them, and then be able to provide an avenue of where they can get help. A lot of patients unfortunately do suffer in silence, and they don't know where to go, and they don't know what actually, is this truly depression, is this just a sadness? So really these tools really help them take a step-by-step approach at looking at empowering them with education and finding then where to go next for help.
So let's talk about some of these symptoms. What can, you know, if someone's watching this morning and think, I don't know, I just am not feeling right, what are some of those big red flags, or, you know, something that people should really pay attention to?
We have the depression symptoms listed on the screen, and really the primary two symptoms with depression is an overall feeling of sadness. And this isn't just a specific sadness over certain situations, such as I lost my job or there is a death in the family. This is an all-encompassing sadness that a lot of our patients say they don't even know why they're feeling sad. Secondly, there is this what we call anhedonia, or this loss of interest. You have a loss of interest in friends, family, things that you used to enjoy. You've really, unfortunately, lost that joy for life.
Can this happen at any age? Is this something that people generally struggle with all throughout their life?
This can happen at any age. It can be a one-time depressive episode, or it can be a recurrent depressive episode. Usually we see depression now as young as kids in their teens, and it can happen at any time and point in your life.
How common is this? How many people are battling this?
It's very, very common, and unfortunately a lot of times it goes untreated, and a lot of times the patients suffer in silence. But if you're having a pervasive sadness, primarily every day for at least 2 weeks, you've lost interest, you start to have physical symptoms such as lack of concentration, you're having issues with sleep, you're having issues with appetite, and even as severe as sometimes there are those suicidal thoughts that can be as severe as a wish to end your life, and as passive as just a simple wish of, I wish I could fall asleep and just not wake up.
Anxiety, I know, is another very common issue that a lot of people are facing with as well. What are the symptoms that come with anxiety?
Anxiety is more of a pervasive feeling of dread and worry. And again, it's not just a pinpointed worry. I don't know how I'm going to pay the mortgage this week. It's that worry that you have all the money in the world in the bank and you still feel you don't know how to pay the mortgage.
Can that lead to depression? Because I would imagine that that would be a stressful way to live.
Yes. A lot of these symptoms end up overlapping. If you look at the symptoms we just put on the screen with anxiety and the symptoms with depression, you'll see a lot of overlap between the two, which is primarily why the medications used to treat depression also have a dual indication to treat anxiety. So when we talk to patients about depression versus anxiety, it's really, what's your primary symptom? Is it a feeling of sadness, or is it a feeling of worry and dread? Because the symptoms of anxiety as well, you still have those physical symptoms, you do have some sadness, you have that irritability. Those symptoms can really overlap between the two.
Well, we have just under a minute left. Here's the good news. There are things that can help. You don't have to feel like this. You don't have to live like this. So what would you suggest people do if they're watching this morning?
The first thing we always suggest is to empower patients with education. You have to be able to know your symptoms, know yourself, to be able to have an effective communication with your doctor to get the help that you need. That first step is education, and there are a lot of online tools that are available. We have some on our website.
Where can we find those?
On our website, www.gulfcoastclinicalresearch.com. There are tools that you can go through that will just ask you questions about how you've been feeling, walk through the symptoms of both diagnoses, and give you basically some feedback on whether or not they feel that you are experiencing a depressive episode or anxiety.
And who is the first doctor that you go and talk with? Is this your, primary physician that you go and say something to first?
It can be, but unfortunately, a lot of primary care physicians are not very well versed when it comes to mental health disorders. And
Can they refer you to someone else?
They can refer you to somebody else. There are a lot of psychiatrists in the area. Unfortunately, they usually do have longer waiting lists, so you can't get discouraged if a primary care doesn't really understand what you're talking about. There are tools, and of course, we're always available at Gulf Coast
as we
to
close
help.
here.
Yes.
Certainly, reach out to Gulf Coast Clinical Research Center.
Absolutely.
Christine, thank you so much for being here this morning.
welcome.
And again, more people need to talk about this. Let's get it started this month.
Absolutely.
Thank you, Christine.
Thank you, Carly.
All right, let's send it over to staff.
Up next, go topless today. Okay, so it's not what you think. We're talking about in your Jeep. We take a cruise with the Calusa Jeepers of Southwest Florida to help raise money for a great cause. But first, a look at your Fox forecast and these headlines.